Hello, my name is Jessica Perez, and for the sport that I chose for this project is cross country at the high school level. Achilles tendonitis is generally a soreness and stiffness that comes on gradually and continues to worsen until treated. It comes on through overuse in particular sports or excessive playing. Mechanisms of injury. Achilles tendonitis occurs when it is overused in a specific sport, which could lead to a tear. It causes pain at the back of the heel or ankle, redness, swelling, restricted movement. In the event that there is a tear of the tendon, the pain will be sudden and severe. Anatomy and assessment. The Achilles tendon is the tough band of fibrous tissue that connects the calf muscle to the heel calcaneus. The Achilles tendon is also called the calcanean tendon. The gastrocnemius and soleus muscles unite into one band of tissue, which becomes the Achilles tendon at the low end of the calf. The Achilles tendon then inserts into the calcaneus small sacs of fluids called bursae cushions the Achilles tendon at the heel. The Achilles tendon is the largest and strongest tendon in the body. When the calf muscle flexes, the Achilles tendon pulls the heel. This movement allows us to stand on our toes when walking, running, or jumping. Despite its strength, the Achilles tendon is also vulnerable to injury due to its limited blood supply at the high tensions placed on it. For assessment, Achilles tendonitis may be resistant to a quick resolution because of the slower healing response of tendonitis tissue. It is important for athletic trainers to create a proper healing environment by reducing stress on the tendon. Also address proper shoe wear and foot orthotics for the athlete, which could be causing irritation and flexibility, which could be causing irritation due to lack of support in their footwear. And also flexibility exercises should be performed for the heel cord complex. Also, icing the area of pain can reduce pain and inflammation. Plantar fasciitis is the most common cause of heel pain. It is also a structural deterioration of fibrosis and pain of the plantar fascia of the foot. It results from progressive damage and repetitive strain and overuse of the plantar fascia. Plantar fasciitis occurs. It is an overuse injury. It is caused by degenerative irritation at the insertion of the plantar fascia on the medial process of the calcaneal tuberosity. The fascia may become inflamed and eventually even tear if there is sufficient pressure exerted at the bottom of the foot. This pressure may be a result of a sudden turn or landing that causes the arch of the foot to flatten and the toes to spread. In most cases, however, plantar fasciitis develops over a period of time. Some athletes are predisposed to this condition because of the pronating feet. This means that the feet flatten and roll inward while walking or running. Since the arch drops, this causes added tension to the plantar fascia. This particular problem is easily addressed with an orthotic placed shoe that mechanically supports the arch of the athlete. For anatomy, the plantar fascia is a flat band of tissue or ligament that connects the heel bone to the toes. It supports the arch of the foot. If it is strained, it gets weak and swollen and irritated and inflamed. And it's easy to assess for athletic trainers because it hurts. Athletes will complain it hurts to walk or stand. Also, there'll be pain and swelling in the area. Treatment for athletic trainers that they recommend is more padding for better shock absorption and less strain on the plantar fascia in their shoes. Make sure that athletics are wearing proper footwear for the type of activity that they are doing. And also, for pain, athletic trainer may choose different modalities such as electrical stimulation, ultrasound, or endoforceps to address pain relief as well as control inflammatory process. And they may also ice the area to reduce inflammation. Medial tibial stress syndrome, which is also commonly known as shin splints, indicates pain in the anterior part of the shin. Conditions such as stress fractures, muscle strains, and chronic anterior compartment syndromes have been termed as shin splints. Shin splints are caused by repetitive microtrauma. Factors that can contribute to medial tibial stress syndrome include weakness of leg muscles, shoes that provide little support or cushioning, and training errors such as running on hard surfaces and overtraining. Medial tibial stress syndrome involves one of two syndromes, a tibial stress fracture or an overuse syndrome that can progress to an irreversible exertional compartment syndrome. Athletes usually complain of pain in their lower leg just posterior to the tibia. There are 4 grades of pain that can attribute to medial tibial stress syndrome. Grade 1, pain occurs after the activity. Grade 2, pain occurring before and after the activity, but not affecting performance. Grade 3, pain occurring before, during, and after activity and affecting performance. And last, grade 4, pain so severe that activity is impossible. Management that athletic trainers can recommend. For medial tibial stress syndrome, the condition is difficult because there are so many factors that can collectively contribute to the development of medial tibial stress syndrome. But athletic trainers can recommend activity modification along with measures to maintain cardiovascular fitness should be set in place immediately. Correction of abnormal pronation during walking and running must be addressed with shoes and, if needed, custom orthotics. Ice massage to the area may be helpful in the reduction of local pain and inflammation. And arch taping and circumferential tape applied around the area for pain may also be used.